Last class we discussed about the sterilization and disinfection, and today we discuss about the disinfection by the chemical agents. Sterilization by the ethylene oxide gas sterilization. Ethylene oxide gas at temperature 108, it is a highly penetrative and non-corrosive agent with a cidal action. That means it kills the microorganism against the bacteria, spores and the virus. So ethylene oxide is a very powerful sterilizing agent for the cleaning the bacteria, spores and the virus. It destroys microorganisms like alkylation and cause a denaturation of nucleic acid. The basic mechanism of ethylene oxide is the alkylation and denaturation of nucleic acid, that means DNA or RNA. The uses of ethylene oxide gas sterilization. Number 1, plastic goods, polyethylene tubes, artery and the bone gaps, vaccine and culture media. These are the components basically sterilized by the ethylene oxide. Then the pasteurization, what is used by the basically the powder milk. There are two methods. One is the holder method, another is the flash method. The holder method generally the low temperature 63 degree centigrade temperature for 30 minutes, and in the flash method in case of high temperature, if the substances can withstand the high temperature 72 degree centigrade for 15 to 20 minutes, and followed by quickly to 13 second or lower. This is the diagram for the pasteurization process. Then water bath can sterilize the moisture. There is the aspirator. The sterilization by the heat at 80 to 85 degrees centigrade for half an hour for successive days. Used to sterilize the media such as Chlorine, ginseng and loafers serum. These are sterilized by the inspirator. These are the instrument used as inspirator. Temperature at 100 degrees centigrade and the boiling. Generally we are killing the microorganism by the boiling of water. Like hepatitis B can survive up to 30 minutes for boiling. Endospores can survive 20 hours or more of boiling. So in that case the boiling is not effective in the killing of endospores or hepatitis B. If the hepatitis B killed, then the time will be the more than 30 minutes. What is the disadvantage? The time consuming, it is very time consuming, does not destroy the spores. Cutting instruments should not be sterilized by the boiling as they are lost their sharpness. Steam by atmospheric pressure. A single exposure 90 minutes usually to ensure the sterilization by the media and contain the sugar and gelatin, and exposure to 100 degrees centigrade for 20 minutes and 3 successive days is issued. This kind is known as the Tinderization or intermittent sterilization. Steam under pressure. Invented by the Charles Babbage, which is 1879. He was discovered the steam under pressure, just like the pressure cooker autoclaves. Two types: on the porous loaded autoclaves and small bench top automatic autoclave. Temperature 136 degrees centigrade temperature and the pressure 32 pounds per and cycle and time which 5 minutes by the flash method. And denaturation and coagulation of the microbial protein by the autoclave during the exposure of the high temperature of the steam. And the temperature and cycle is the 15 to 20 minutes and temperature 125 psi. Those material which are, these are the very advantages of this method. It is but efficient cycle time, good penetration, that can be this high pressure can penetrate the microbes and kill the microorganism. An ability to process a wide range of material, but some limitation or disadvantage at the caution of the uploaded carbon steel, and during this protection cutting edge and possibility that packages may remain wet at the cycle, and possible deposition from the use of water, and possible destruction of heat sensitive substance. So it is a very disadvantage of this. If the substance is a heat sensitive or heat labile, that type of substance cannot be sterilized by this method. And sterilization by the low temperature by the formaldehyde. So in that case, this is the method used for the combination of the dry saturation steam and formaldehyde to kill the bacteria. Two types of candles are for the, one is the candle filter of the water for the industrial as well as the drinking purpose, and asbestos filter like this disposable syringe use discs and they have a very absorbable capacity and alkaline in the filter. This is the filter. No filter candle gas filter which is used for the water treatment and also in the laboratory also. They are prepared by the heat fusing finite powder glass particle or gradient sizes, low absorb property and brittle and expensive. Membrane filter, the most effective every sterilization process is the fail, then you can apply this process because it is a very costly as well as the instrument is very huge instrument is required for this sterilization technique. Generally two type of sterilization, one is the non-ionizing and ionizing radiation. In non-ionizing radiation, generally infrared or syringe and catheters, the plastic syringe and the catheters which are used for the operation theater, and disinfection enclosing areas such as airway operation theaters and the laboratories which can be sterilized by the radiation technique. And it is also ionizing radiation, it is also called is cold sterilization. This is very important, you can remember for in future for the competitive exam. It is called sterilization ionizing radiation because it produce sterilization but no temperature will be produced, that's why it is called as cold sterilization. Number one, the X-ray, gamma ray, cosmic ray and high lethal to DNA. Basically this ray which is denatured or lethal effect on the DNA and other viral constituent. So they have a high penetration power, and since it is no appreciable temperature. Basically it is a commercial plant used because it is very costly. For gamma radiation sterilization items like plastic, syringe swabs, catheters, animal feeds, oils, greasy and fabrics, those are sterilized by the radiation method. And ultrasonic sound and ultrasonic vibration, these are the another technique by which you can sterilize. Ultrasonic and sonic waves then created the bacterial power by the result of this variable. Microorganisms vary in the sensitivity to survive and founds every after the treatment. Hence, it has no practical value in the sterilization and disinfection. You can see it continued. Next, and the most important factors, those chemicals which are used for the sterilization, or basically it is used as a disinfectant. Chemical agents classification in this category, we are discuss about the chemical agents, classification of the instrument to be sterilized, test of sterilization, disinfectant, infection in the dental properties, universal precautions, patient preparation, unique wear line, and occupational and accidental exposures, waste regulation. Chemical agents were classified in this category. Number one, the alcohol. Under this, ethyl alcohol, isopropyl alcohol, and trichlorobutanol. Aldehyde, formaldehyde, and glutaraldehyde. Already I discussed. Dyes, aniline, and acridine. Another is the halogen like iodine and chlorine, and phenol and metallic salt. Ideal property of the disinfectants. What are the ideal properties of these disinfectants? Number one, it is widely spectrum of activity. That means they are active with the gram positive and the gram negative atoms. Active in the presence of organic matter, which is must be not only the inanimate object but also the animate object like organic matter. It should be used. Effective in the acid as well as the alkaline media. Speedily the action. It is effective against both the alkaline media and the acid media, and speed to the action, and high penetration power and stable and compatible with the other antiseptic and disinfectant. No corroid material. These are the ideal property. Not only that, not causes the any local irritation or sensitization. Not healing. Not it will be another most important properties of this ideal chemical disinfectant. Non-toxic, non-irritant, it observe not in the circulation, cheap and easily available, safe and easy to use. Mode of action of the chemical disinfectant. Basically all the chemical, most of the chemical, about 90% chemical, which is the basic mechanism to kill the microorganism by protein coagulation. That means the protein or microorganism will be coagulated by this method, and disruptor is the disruption of, because the cell membrane is the outer wall of the microorganism. If the cell membrane can disrupt by any chemicals or by any means, automatically the organism will be killed. So another method by the chemical agent, which is disruption of the cell membrane. Number 3, removal of sulfahydryl group. This sulfahydryl means SH group, which is basically present in the enzymes. If the chemical penetrate in the body and combined with the SH group or sulfahydryl groups, the automatically the enzymatic action will be hampered and ultimately the organism will be killed. So the third one is the removal of free sulfahydryl groups. Next, last one is the substrate competition. Substrate competition means sometimes some foods and some nutrients which is required for the growth and development of the microorganism, and that chemical which is used as a competition with the substrate, that substance which is not essential for the microorganism, but it just like a or structural resemble with the nutrient, food and other material, that chemical which introduced into the body inside the microorganism, the kill or death of the microorganism. First one is the alcohol, which is the very common and effective sterilizing agent or disinfectant. Number 1, ethyl alcohol, isopropyl alcohol, now which are used as a sanitizer for the prevent the hand sanitizer, prevent coronaviruses. To ethanol and isopropyl alcohol are frequently used. No action on spore. This is the disadvantage of this particular chemical compound. And concentration recommended 60 to 90%. Generally more than 70% of ethyl alcohol, which is acts as a sterilizing or disinfection. What are the uses of ethyl alcohol? Disinfection of clinical thermometer. Generally we use this clinical thermometer before it use ethyl alcohol. Phenol also. The spectrum of activity. Effective against the fungi, vegetative bacteria, mycobacterium species and some lipid containing viruses, those type of organism which is killed by the ethyl alcohol. But there is some limitation, not effective against the spores, and concentration most effective at 70% in water. Caution, do not use near the flames because it is flammable substances and may soil rubber or hardening the plastic. If the ethyl alcohol used for the plastic surface or rubber surface, the rubber or the plastic is hardening. And there is the aldehyde, the formaldehyde, to preserve the anatomical specimen like liver, lungs, etc., which are used for the preservation of by formaldehyde. Generally the use the formalin solution, generally the 38 to 40% formaldehyde is called the formalin solution, and destroying the anthrax spores in the hair and the wool. 10% formalin and 0.5% sodium tetraborate is used for sterile the main metal instrument. For metal instrument, generally there is a specific method by which you used. Be careful at the concentration of this enzyme or concentration of the formaldehyde. In case of formaldehyde, the 10% formalin plus 0.05 sodium tetraborate. Formaldehyde is the gas. It is used for the sterilization of the instrument and heat sensitive catheters, for fumigation wards and sick and rooms and labs. Formaldehyde can react with the free chlorine to produce the toxic gases and irritation in the vapor by the increasing the hence the neutralizing with the ammonia, which these are the process by which the formaldehyde can use for sterilization of the rooms and outside the room also. Another is the glutaraldehyde, another aldehyde group which is very effective for the sterilization. Number concentration is very important in this case of chemical compound. The glutaraldehyde commonly available in the 2% W/V aqueous solution, which is maybe used for the alkaline to activate. 2% glutaraldehyde solution is used for the 10 hours, can use to sterilization heat labile substances. That means heat labile substances can be sterilized by the 2% glutaraldehyde for 10 hours. And the spectrum, it is effective against vegetative bacteria, fungi and maybe other organisms. And basically the sharp instrument, floor instrument and other instrument, rubber substance, rubber material or plastic material can be sterilized by the glutaraldehyde. But there is some precaution. Glutaraldehyde is also known as a it causes dermatitis and the asthma. That means if inhaled by the glutaraldehyde, it produce or contact with the skin, it produce dermatitis, produce skin infection, and produce, if it is inhaled, it produce asthma. So there should take care about to avoid it. It cannot be inhaled by the person or the people. It should not be used in the area with a little or a ventilation. That type of is a little area or congested area you cannot use because it produces some asthma or dermatitis. So it can be used in the open area. And before it used, it must be your eye must be protected, and it the plastic apron and the gloves must be should be stored away from the heat sources, and it is contained with close fitting, otherwise it will be leakage of these gases. The length of the time and the glutaraldehyde solution can be used in the varies, but they are usually good for 14 days. Dye, there are two dye used for the disinfectant. One is the aniline dye, another is the acrylic dye. Aniline dye, it is a brilliant green, magenta green, crystal violet, which is active against the gram positive bacteria, no activity against the gram negative bacteria. But rather than the aniline dye, acrylic dye, which is very better than the aniline dye, because aniline dye, which is used as orange in color, but it is effective against both gram positive and the gram negative bacteria also. Another is the halogen. Generally, we are using in case of pharmaceutical and other medical profession, they are used iodine preparation. Around 5 types of iodine preparation: 5% solution, weak solution of iodine, strong solution of iodine, Lugol solution, and povidone iodine. So iodine in case of pharmaceutical industries or pharmaceutical product, the iodine is a very good component for the preparation of disinfectant, and which are used for the skin and the bactericidal with the moderate action against the spores. So we are using this type of iodine. So many, basically in case of povidone iodine, which is marketed in the betadine for sterilizing or disinfection of the skin. Chlorine, another important halogen is the chlorine. The chlorine, which are for the water treatment plant in case of municipality and others water treatment plant also, chlorine is used for disinfection in the water supplies and pools in the foods and the dairy industries. Another is the phenol. Generally phenol is used of the coal tar between the temperature 170 degree centigrade for 2 and 270 degree. It is a powerful microbicidal, and phenolic derivatives have been widely used in the disinfectants and for the various purpose is the hospitals, and their derivatives are the lysol and cresol. So many home or house user use the lysols and cresol used as a disinfectant. The use of phenol to clean the wards and the various combination of use of the control and the pyrogenic cocky in the surgical and neonatal units in the hospital, and are used in the treatment of wounds also. Metallic salt, nowadays the Lifebuoy or other soaps industry, they are used some silver, copper and mercury used for the disinfectant. And also same mechanism by coagulation. Basically this metal ion which coagulate or denature of the protein, coagulation of protein, and marketed the bacteriostatic and weak is the bactericidal and limited fungicidal activity of the metallic salt. Classification of the sterilization to be sterilized. Number 1, critical, semi-critical and non-critical. What are critical? Critical means the penetration of the soft tissue and bones should be sterilized after each use, like forceps, scalpel, burn, scales, instrument and bone chisels. Bone chisels which is sterilized very carefully, it is very critical to sterilize. Semi-critical, which are not penetrate the soft tissue or bone but it contact with the mucosa. That type of substance or instrument, it is called the semi-critical substances, like mouth mirror, growth cutting burns and amalgam carriage and plastic instrument. Non-critical, those substances or material which come into the contact with the body. Low level disinfectant used like cavity liner, cement spatula and sedimentant jar. These are the picture: critical, semi-critical and non-critical. Cause of sterilization failure. Though we are discussing about some chemical which are used for sterilization, but there is some lacuna if it is chance of failure. So what are the causes of the causes for the failure of the sterilization? Number one, improper cleaning of the instrument. If before the sterilization the instrument is not properly clean, so there is a chance of failure of sterilization. Another is the improper packing in sterilization. Improper temperature is sensitized. If the substance is a heat sensitive substances or heat level, in that case the temperature will be high, then there is a sterilization will be failure. Improper loading of sterilizer. Sterilizer must be loaded in the proper concentration, otherwise or as per the protocol, otherwise sterilization is not effective. Improper timing of sterilization cycle. Suppose in case of autoclave the 15-minute, if you less than 15 minutes, then there is a failure of sterilization. What are the steps to taken after the sterilization on failure? Take the sterilizer out of service. Process to identify the problem. First of all, you which is the main cause of failure, then you can rectify it and reset and observe the cycle and determine the fates of sterilization and thrust the repair to new sterilizers. Test for the sterilization. There are so many stage sterilization. Different microorganism and chemical indicator are used for the sterilization. Different microorganisms and the chemical indicator generally after the sterilization which is occurred, which is complete or not, that will be done by the used by the in case of chemical, in case of assay which is some indicator, that indicator change the color, that means indicator change the color, you can confirm the assay is complete. In that case the sterilization, whether it is indicator used for the sterility test. Number one, microorganism. In case of steam autoclave, biological indicator use, be careful, listen it, and important parameter is the steam autoclave. Bacillus stauros thermophilus, vials or ampoules and the steam used for biological indicator. Dry heat oven, Bacillus subtilis, and in case of dry gaseous sterilization or radiation, Bacillus pumulis, which is not mentioned here, Bacillus pumulis for radiation technique. Chemical vapor, Bacillus stearothermophilus, and in case of ethylene oxide, Bacillus subtilis. There are also various important concentration of disinfectant commonly used for the disinfectant. Sodium hypochlorite 0.1 to 0.5%, Sidex 2%, glutaraldehyde, chloramine 2%, ethyl alcohol 70 to 90%, formaldehyde 8%, formalin 20%, bigonates and povidone iodine 2.5% of phenol. So today we discuss about what are the properties of the ideal disinfectant. Ideal disinfectant, broad spectrum of flat and action, not effective by the physical factors, non-toxic, and surface compatibility obviously, and should not have a residual effect on the treatment of surface, easy to use and cuddly. So we can discuss about the chemical agent which used as a disinfectant as well as the sterilizing agent. Next class we discuss about details about what are the biological indicator or chemical indicator for evaluation of sterilization. Thank you. If any question, please given in the chat box for discuss in the classroom. Thank you everybody for listening the lecture. Okay, thank you. হয়ে গেছে, এবার কী করবো? এটাকে শেয়ার করে দিয়েছিলাম, বন্ধ করেছি।